I have my support team 3 times a week, Monday, Tuesday, Wednesday. On a Monday I go shopping or bowling, and a Tuesday and Wednesday I go to work. I am a communications assistant at Bobat, Scotland, where I do blogs and I plan get-togethers for adults with cerebral palsy, and I do much more.
The care standards for me clearly tell us that the most important person is the person being supported. The use of I throughout the new care standards brought it into focus, being able to understand what was expected of people who provide support.
We're very pleased to have standards that provide an opportunity to ensure that people who use services understand their human rights and the dignity and respect that they should be afforded when they're involved with services, and can be supported to advocate for these with commissioners and regulators.
They say that service users and workers shouldn't have a friendship, but it is difficult not to build a friendship, and I think it is important to have workers who mostly the same age than me.
One of the key benefits of the new health and social care standards is the extent to which they're so well aligned with the principles of self-directed support. And what this does is provide us with an opportunity to develop methodology that supports greater choice and control, positive risk-taking, and a focus on individual outcomes.
To help the folk realise what they want from their life, and that in actual fact they have the choices in their life to achieve what they want to achieve.
Having workers feels like I am living my own life.
I have care people 4 times a day: morning, lunchtime, tea time and bedtime. In the morning they get me up and I either have a shower or hand wash. At lunchtime it's the same, they come in, they just make my lunch. And then in the afternoon it's again the same, they come in and they make my tea. And then at night, bed for me. It makes a difference if I have the same carers morning and night. You really do get to know them and they're the same with you. They just converse. It's like having family. They're interested in what I've been doing, talking just generally all the time. It's great.
My job makes me feel very rewarding. I can go home and put my head in a pillow at night knowing that I've took care of folk all day.
I think the care standards help to ensure a consistent quality of care, and they help to ensure that there is a consistent and responsive care provision for those who are actually receiving the care. On a personal level, I think the care standards are good for everybody concerned in the social care business.
What they do is create the conditions for a person-led care journey across the sector that's of high quality the way it should be, not about ticking boxes, but about the values of dignity, respect and compassion.
The care standards make you not so much focus on the time because it's so easy to feel rushed, and more to focus on their needs and the outcome and meeting their outcomes.
It is mostly about not how they're treating me as a patient, but how they're treating me as a person. I'm really very grateful that I can have them. It's very like having an extra family. It really is.